Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, what are the clinical features of raised intracranial pressure? So, we have raised intracranial pressure. So, what are the clinical features of raised intracranial pressure? The main clinical features of raised intracranial pressure include the patient can have headaches with vomiting, bradycardia is seen in the patient, along with hypertension. There can be visual field loss can be seen with transiently obscure vision. Visual field loss can be seen with transiently obscure vision. There can be presence of bilateral sixth nerve palsy is seen in some patients, and sometimes pupils will constrict. Later they might dilate later because of the intracranial pressure, constriction of intracranial pressure. This can cause compression of the nerve, that is optic nerve, resulting in papilla edema can occur. It can also result in pulsatile tinnitus, it can occur. And raised intracranial pressure can cause altered sensorium, and it can also result in chain stroke breathing. So these are the main symptoms of raised intracranial pressure. In them, if you were asked what are the early signs, sorry, in the raised intracranial pressure, what are the early signs of raised intracranial pressure? Early signs of raised intracranial pressure are actually drowsiness and altered mental status is the early signs of raised intracranial pressure. Then, if you are asked what are the late signs of raised intracranial pressure, if the patient is in coma or if the patient has unilateral pupillary dilatation, these are the late signs of raised intracranial pressure.
thank you and thank you for watching.